Okay, Dr. Buford here. I guess you should probably assume that. And we're having our second look here, Jacob. So this is your biceps tendon. Here's the posterior suture from the slap repair, and you can see how that gets covered up by soft tissue most of the time. And that looks pretty stable. The biceps anchor itself looks pretty stable. This anterior suture, you can see that's pretty rock solid. I'm going to go ahead and trim this back because we don't need it anymore, on the off chance that that's causing any symptoms. I don't see anything really new in the biceps. This labrum here is a little bit loose, but it's well attached here. And we did check your shoulder for instability again, and there's still no signs of instability. I'll come all the way around. Oh, there's a little cartilage lesion there. And as you get all the way around to the back, we can see the posterior capsule looks great. Okay, so we're just clipping this anterior suture that's not covered up. There it goes. And so now we'll be able to remove that pretty easily with a grasper. And now, there, we just took that suture out. So now that suture's gone. So if that was the culprit, we're done. I'm going to try and smooth out this labrum just a little bit more. Okay, so now we're looking down the front of your shoulder. The camera's in the front. We're going to gently pull back on the humeral head, and that gives us a pretty good look down the front. That ligament you see, that thickening in the capsule coming towards the camera, that's the anterior band of the inferior glenohumeral ligament, and the fact that you have a well-defined one is a good sign. It confirms the fact that there's probably no significant anterior instability. We've been using this just to debride any of the labrum that looks like it might be a little bit loose. And again, this is really, truly fine-tuning this. We'll show you some more in a little bit. Okay, so even though this knot's covered up, there's no reason to leave it at this point. It's done its job. And so just a few snips, and probably with a pair of scissors, which we'll get in just a minute here, we'll get this knot removed. Okay, so now that knot's removed, so there's really nothing else in terms of suture material that's left. The basket, the biter. I'm going to explore this anterior superior labrum one last time here before switching the camera to the back. I just want to try and make this edge as smooth and as polished and pretty as we can here. Switching stick. Okay, so we've got all the sutures out. I've been tugging on this biceps trying to see if there's any reason I could use to justify doing a tenodesis at this point, and I just don't think so. We've rotated your arm, we've taken it out of traction, and I'm optimistic that hopefully this will do the trick for you. We've taken out all the suture material, and we've trimmed back this labrum. So I'm really hoping this does the trick for you. So good luck to you now. Bye-bye.